What are alternatives to subcutaneous fluids for dogs? If you are a pet owner concerned about your dog's hydration, you might be wondering what options are available besides subcutaneous fluids. Let's take a closer look at some alternatives that can help keep your furry friend hydrated and healthy. First up is oral hydration. If your dog is able to drink water and keep it down, encouraging them to take in fluids is a great first step. You can offer plain water or even electrolyte solutions designed for pets. This method works well for mild dehydration and is the least invasive option. However, if your dog is vomiting, lethargic, or unable to drink, oral hydration may not be sufficient. Next, we have intravenous fluids. This method involves placing a catheter into a vein to deliver fluids directly into the bloodstream. Intravenous fluids are typically used in more severe cases of dehydration or critical illness. This option requires a visit to the veterinarian, as it needs careful monitoring and can only be done in a clinical setting. Another alternative is intraperitoneal fluids. This method is less common and involves injecting fluids into the abdominal cavity. It is usually reserved for specific situations and is not typically used for routine care. Additionally, nutritional support can play a role in hydration. Sometimes, addressing the underlying causes of dehydration can reduce the need for fluid therapy. This might involve medications, dietary changes, or even feeding tubes in certain cases. Veterinarians often prefer subcutaneous fluids for outpatient management of chronic conditions like kidney disease. They are easier to administer at home and are generally less expensive than intravenous fluids. However, when subcutaneous fluids are not an option, intravenous fluids become the next best choice. In summary, if your dog can tolerate it, oral hydration is the first line of defense. For more severe needs, intravenous fluids are the way to go. Intraperitoneal fluids and nutritional support are also options, but they are used less frequently. Always consult your veterinarian to determine the best approach for your dog's specific needs.